Today I'm going to talk about my personal supplements, what I take or have taken on a daily basis and why. Now, just as a quick disclaimer, I want to say, please research these things on your own, or even better, talk with your medical provider before taking any supplement, because there's always the risk of interactions with other medicines, with other supplements. Okay, with that said, I think it's very helpful to take some basic vitamins just to promote general cellular health. Vitamin C is a well-known antioxidant, and at a minimum is going to do no harm. Anything over 250 micrograms, or milligrams rather, gets secreted from the body fairly rapidly, but it's hard to find anything, real low dose. They're almost all 500 milligrams or 1,000 milligrams. So I just get 500 milligrams of vitamin C, and I actually prefer to take that twice a day. I have a pill box to organize all my supplements, and a day of the week pill box. So, for example, this is what I take Monday morning, and this is what I take Monday at noon. And I just go down the line to keep track of these things. So I'm currently taking that twice a day. Vitamin D has a lot of, you don't want your vitamin D to be low. You can get it tested in the blood, but for optimum functioning of your immune system, you need enough vitamin D. And of course, vitamin D is generated by your skin upon exposure to sunlight, but a lot of people, especially in the northern climates, do not generate enough vitamin D, especially if you're, homesick or laying on the couch a lot of the time. And with vitamin D, it's important when you're supplementing. I recommend 2,000 to 3,000 micrograms. It is possible to go up to 5,000 or even 10,000 micrograms, or rather international units. But I really don't think we want these high doses of vitamin D. Vitamin D is almost like a hormone. And actually, if you go up to the mega doses of vitamin D, like 30,000 units or 50,000 units, it triggers autophagy. So it's, all these things are good in the right amount. And it's important to prevent calcium loss from our bones. It's a good idea to take some vitamin K2 as MK7 with the vitamin D supplement. Now, you can take that as a separate vitamin K supplement, or some daily vitamins have a significant amount of vitamin K2 in it. This is one that I'm currently using. I like. This one has 60 micrograms of vitamin K, which is 50% of the daily allowance. Which brings us to a standard multivitamin. Just cover your bases. It has low levels of vitamin C, vitamin D, vitamin K, the B vitamins, 15 milligrams of zinc. And I always look to see how much vitamin B3 it has. And typically they list it as niacin, sometimes as niacinamide. So this one has 20 milligrams of niacin, because vitamin B3 is particularly important for long haulers, I think. So it's good to know that amount. And vitamin B12 is also particularly important for long haulers. Basically, all the B vitamins are involved in cellular energy production in some way. So when we're dealing with fatigue, severe fatigue and long-term fatigue, the B vitamins can be really important. This one has 100 micrograms of vitamin B12, which is fairly standard for multivitamin, but don't be alarmed by the percent of daily value. That's 4,167% of the daily value. Well, when they set the minimum daily value or recommended daily value of vitamin B12, apparently they set it at a really low level, because whenever you're looking at B12, you get these super high percent of daily value. And basically, high levels of NAD plus trigger cellular autophagy. So it's yet another way to induce the stress response of our cells. So, I've played around with both niacin and niacinamide. 500 micrograms of those induces strong autophagy in me, like an increase of symptoms, like an increase in headache, gut ache, ringing of the ears, etc. Whatever your long haul symptoms are, they increase in me from taking 500 milligrams of niacinamide, just like I was doing a water fast. It feels exactly the same. That's why I think 500 milligrams of niacin or niacinamide triggers autophagy. And I've tried lower doses, and even at 200 milligrams, I get a slight increase in my symptoms in the evening. So that's why, since I don't want to stress my cells on a daily basis, that I'm all into this periodic autophagy, that's why I recommend 50 or 100 milligrams at noon. So if you have bad fatigue, you might go for 100 milligrams a day. As you feel better, you might lower that down to 50 milligrams per day. Okay, and now, so these are the basic core vitamins. This one's, to help, specifically to help fatigue and cellular health, and maybe sleep and insomnia and anxiety and depression. And then lysine. This is a relatively new discovery for me, but lysine is just, one of the basic amino acids. Amino acids are just the building blocks that are strung together, assembled and strung together to build proteins. So it's a fundamental building block in our cells. And it turns out that the key regulator of cell metabolism is this protein computer mTOR complex, and it's tied into various sensors. And one of the things it looks at is the level of amino acids. And the key amino acid this mTOR complex measures is the basic amino acid arginine. And so it just says, if there's a lot of arginine available, then there must be a lot of nutrients available, and I'll put the cell in a pro-growth, take it out of the G0 phase, allow it to replicate and divide if necessary. It's just like life is good. And what happens when the cells are in the pro-growth mode? That's when viral replication can take place. And my experience was I started taking this 500 milligrams before every meal, before the Thanksgiving holiday here in the US. And suddenly I indulged myself at Thanksgiving. I ate pretty much everything on the plate, which is a big, gigantic feast, including pies and all kinds of stuff that I knew I shouldn't eat. But I really didn't suffer any consequences, and I was pleasantly surprised. And so then about a month after that, I upped it to 1 gram before every meal, and it just seems to me like all my slow, steady gains I make via periodic autophagy, I now get a hold on to. And whereas before, during the summer, I would make slow, steady gains, and then all of a sudden, one day or 1 week, I'd feel worse. Or I had a flare at the beginning of September, all of a sudden I had tinnitus and couldn't read, had difficulty reading, and brain fog. And it's like, those flares, those relapses, minor relapses are so frustrating. So this is a new one that I'm recommending, but I strongly recommend people give it a try. And basically just take 1 gram before each meal. Ideally, you'd take it, 15 minutes before a meal, but I've just been taking it, first as soon as I sit down at the table, and then maybe I'll start eating 5 minutes later. Now, I've had a couple posts looking at the lysine-arginine ratio of various foods, and it turns out that most meats and dairy products are relatively high in lysine compared to arginine, like yogurt or milk, which I know a lot of long haulers are sensitive to dairy. I've never been. So my first long haul, I mean, I ate yogurt almost every day, and I recovered, had a relatively rapid recovery to full recovery. And yogurt and the lysine in yogurt might have been part of that. Then now, what foods are high in arginine? Well, the foods that have the highest arginine to lysine ratio are almost all nuts, walnuts, almonds, pecans, cashews, etc. One of the things I mentioned earlier, that B vitamins are very key to energy production at the cellular level. And if vitamin B12, if it gets depleted at the cellular level, then its levels can stay depleted for a long time, because it's present in a number of foods, but our bodies are not very good at absorbing vitamin B12. So even if we take a B12 supplement, it might take a month of supplementation to restore the normal level of B12 in our cells. And my experience was that I don't know, several months ago, I still had some lingering fatigue. I was fine most of the time, but it was curious. I would eat breakfast, and an hour after breakfast, I'd feel fatigue for like an hour or two. And it was like the same pattern every day. And I still don't know exactly what was behind that. But I started taking half a dose of this super B complex. And there's a lot of B complexes out there. Basically, it says serving size is 2 tablets. I was taking 1 tablet, which provided 450 micrograms of vitamin B12. And I did that for a month, and suddenly, or not all that suddenly, but my after breakfast fatigue totally went away. I don't have the fatigue at all anymore. And so I suspect that this helped. I don't know for sure, but it's worth giving a try for a month and see if it helps your fatigue or not. Or you can just try, the pure B12. Another optional supplement is quercetin. For a long time, I've had this as a key recommendation in the protocol, because in my second long haul, I'd read that quercetin helps stabilize mast cells, and that maybe quercetin plus zinc might have some antiviral properties. Well, I did not know it then, but it turns out that quercetin at higher amounts triggers autophagy, and zinc at higher amounts triggers autophagy. So I'm thinking that quercetin plus zinc is just another way to trigger autophagy. Anyway, I was taking this 800 milligrams of quercetin plus 22 milligrams of zinc daily in my second long haul, where I went from severe long COVID symptoms to basically 0 symptoms in like 3.5 months. And when I was experimenting with all these alternative autophagy inducers, everything was on top of this quercetin plus zinc. But now I realize, hey, this is an autophagy inducer at 1,200 milligrams per day. And so now I'm like, yeah, I'm not so sure that's a good idea to take daily. Still, if you have cast symptoms, allergic symptoms, runny eyes, runny nose, and itchy skin, and these weird allergic sensitivities, what's happening is that your mast cells they're everywhere you have blood vessels, and along the surface of your skin, and even in your brain, close to the blood-brain barrier. These mast cells are the guards or sentries of the immune system. They just stay put, and they're vigilant, and they're on alert for any potential viral or bacterial or parasitic invader. And their job is to sound the alarm once they detect an invader. So if we're dealing with like a chronic low-level viral infection, which is my opinion, and there's increasing evidence for that, it's not surprising that a pretty good percentage of long haulers have this. Quercetin is known to stabilize the mast cells or help stabilize them. So if you have these MCAS symptoms, you might try taking quercetin, and I think 500 milligrams is a reasonable dose that's not going to trigger autophagy daily. Or you can take any of the H1, H2 antihistamines, over-the-counter stuff. That's my thoughts on quercetin, my current thinking on quercetin. I'm kind of backing off on the quercetin. And at the same time, I'll say zinc. It's present in a multivitamin, and I've taken higher amounts of zinc, and it's also triggered autophagy for me. So when you're reviewing your supplements, make sure your total amount of zinc does not go above 22 or 25 milligrams per day. A little bit's good. A lot is another way to stress your cells and trigger autophagy. So, all down here, we're talking about optional supplements. Another one that may be helpful is a low dose, relatively low dose of a statin. I personally take 10 milligrams a day of atorvastatin. Particularly helps lower the LDL, the bad cholesterol. Well, I was taking this before I got long COVID, and imagine my surprise one day when I think I saw in Dr. Patterson's protocol that he was having long haulers take statins. And I'm always checking to see, what triggers autophagy and what doesn't. Well, I took 40 milligrams of my statin, and it triggered strong autophagy, which means it is stressing our cells. Basically, if it interferes with the normal healthy production of fatty acids in our cells, that's probably yet another way to stress our cells. Maybe it has some other action, but it's probably acting through HMG-CoA reductase. And it turns out that the SARS-CoV-2 virus, at least in one cell culture study where a bunch of lipid cholesterol researchers were looking at the SARS-CoV-2 replication, when they took a really high resolution picture of infected cells, they found the viral particles associated with the surface of these fat or lipid droplets within the cells. And when they inhibited fatty acid production, they inhibited SARS-CoV-2 viral replication. Now, this is all in cell culture, but still, to me, it suggests that the flavor of autophagy, where we degrade lipid droplets, which is called lipophagy, might be especially helpful for us to reduce our viral load if there's persistent virus. It's not a bad idea to try 10 milligrams of a statin. Now, there's a natural alternative, which is this red yeast rice that has monocolin K, which is basically the same chemical that's in the statin, lovastatin. And I played around with some red yeast rice extract, and it was at higher levels, it was triggering autophagy. So a lot of times this red yeast rice comes in a 600 milligrams per capsule, and I'm telling you, that's too much. But at 250 or 300 milligrams of red yeast rice, you can get, it's like taking a low-level statin, I think. NAC, N-acetylcysteine. So earlier I was talking about lysine and arginine, which are two of the amino acids building blocks that make up proteins. Well, cysteine is another amino acid building block. And it turns out that the number one cellular antioxidant in our cells is glutathione, which is just a string of 3 amino acids, and one of which is cysteine. So, and it turns out that if we give our body more cysteine, our cells create more glutathione. So they have more protection against oxidative stress. And viral infection, a whole bunch of viral infections are known to cause oxidative stress in our cells. because when this virus takes over our cells and uses it as a factory to replicate more virions, it doesn't do it in a friendly, gentle way. It aggressively takes over the cell and uses it for its own purposes. I'd say this is optional, but because it can, when we boost glutathione, it can block the induction of autophagy or make it harder to induce autophagy, because a lot of these plant flavonoid compounds kind of short circuit our mitochondria, which causes us reactive oxygen species. The reactive oxygen species bounce around our cell randomly, and whenever they hit a protein or a lipid or even DNA, they just react to it and damage it. And they also, a lot of them do this by basically short-circuiting the energy production electron transport chain in our mitochondria. NAC, because it's such a strong antioxidant, makes it harder to get to the level of oxidative stress needed for the cell to trigger autophagy. So when I take NAC, and I take 600 to 750 milligrams, when I take that, I avoid taking that on days where I'm fasting or triggering autophagy, and I avoid it the day prior to days I plan to trigger autophagy. I've actually cut back NAC, personally I've cut back NAC quite a lot, because now I'm basically at zero symptoms unless I'm triggering autophagy, and I just feel like I don't need it anymore. But if I was a very sick long hauler with bad brain fog and maybe some breathing issues, I would take NAC. So next I'm going to talk about aspirin and nattokinase and serrapeptase. There's a lot of evidence now that long COVID, as well as acute COVID-19, is a vascular disease, because it can affect the SARS-CoV-2 virus can affect the endothelial cells that form a single cell layer along the blood vessels, the lining of the blood vessels, and it can also infect the parasites, which is the next cell layer out from the blood vessels. There's growing evidence, mainly out of the Riccia Pretorius lab in South Africa at Stellenbosch University, that long haulers, perhaps the vast majority of long haulers, have microclots, and these microclots are resistant to the normal degradation by the trypsin protease. She had to treat these microclots with trypsin, do a second trypsinization, and still under fluorescence microscope, she was seeing these aggregates of clumped cells and fibrinogen nets, these so-called microclots. Currently, nobody knows, how best to treat this, how to get rid of them. There's, I think, Pretorius, along with Dr. Jaeger in Germany, have, for some patients, tried this triple therapy, which is, using these strong antithrombotic agents to try to prevent blood clots and dissolve the blood clots. But that's a risky thing. In cardiovascular patients with serious heart conditions, those are the people that normally get this triple therapy. And they only get it because the risk of dying from their heart condition is greater than the risk of having a severe bleeding event from their triple therapy. So anytime you interfere with blood clotting, you increase your risk, at least slightly, of these adverse severe bleeding events. So when we start playing around with antithrombotic agents, caution, like tread lightly. There's a lot we don't know about long COVID and microclots. So that being said, the risk of a severe bleeding event with this triple therapy is roughly 12% per year, which is very significant. But if we just use like daily baby aspirin, then the risk of a severe bleeding event goes way down. it's still there, but it's greatly reduced. But if we start layering other things on top of it, the risk would increase. So what I have been doing, actually, I was taking low dose baby aspirin, or 85, 81 milligram aspirin before I got long COVID, just for general health and anti-inflammatory. I was taking this in my first recovery when I got to fully recovered. I mean, I was hiking in the mountains and doing strenuous backpacking in 4 months. And, I didn't realize it at the time, but that may have been a positive factor in my recovery. And now a lot of long haulers have been thinking about, using various enzyme supplements that are available over the counter to try to degrade microclots. So such as nattokinase, serrapeptase, and lumbrokinase. And of these, nattokinase, I think, has the most specificity for fibrinogen. And when these clots form, on the outside, there's these fibrinogen nets. It's like the fiberglass in a cast on your foot. And they're very tough, they're very resistant to digestion. But nattokinase, at least in a test tube, is able to dissolve and degrade fibrinogen. Now, the microclots may have other agents in them that make them especially difficult to dissolve via any protease. So, no guarantee, it's unknown yet, if nattokinase or serrapeptase will actually help the treatment of microclots in long haulers, or what's the right dosage, what's the risk, etc. A lot of unknowns. And symptoms that might be caused by the microclots could be a contributing factor to the peripheral neuropathy, the tingling and the numbness in the hands and the feet that some long haulers have. And it could be, could contribute to shortness of breath. It could contribute to a number of things. Anywhere you have these microcapillary vascular beds, those really, really small capillary blood vessels are probably the most likely to be negatively impacted by these microclots. But to what extent these microclots form in the capillaries, and to what extent they cause local tissue oxygen shortage or hypoxia, it's really unknown yet. It's just a concern, because lack of oxygen could cause a whole bunch of symptoms. So between these two, I've taken nattokinase and serrapeptase. I actually like this natto-serra supplement, which is a combination of nattokinase at 2,000 fibrinogen units and serrapeptase at 40,000 SPU, or serrapeptase units. I can tell you I've taken that. I haven't had any adverse side effects. I haven't really seen any benefit either. And then again, I'm not a very sick long hauler, so your experience might be different. But after experimenting with that, I've gone back to my daily aspirin, because I think an ounce of prevention is worth a pound of cure. So, and I think the aspirin is our best bet to act at an early stage in the clot formation. And basically, low-dose aspirin is antithrombotic by preventing platelet activation and clumping of platelets, which is like the very first step, initial step in the formation of blood clots. So my money currently is on low-dose aspirin. And what dose is optimum for long COVID? Again, nobody knows. Traditionally it's been taken at about 80 milligrams per day for its antithrombotic activity. Perhaps, to extend that antithrombotic activity to the microcapillaries, perhaps we need to double that. Nobody really knows. But aspirin does increase your risk of adverse bleeding effects, especially in the stomach. So, and everyone has a little bit different sensitivity. So I just kind of put up the caution flag on any of the antithrombotic agents. So now just to summarize, what I think about the supplements currently, and this is going to change and evolve over time. I think the core supplements are the vitamins that just promote general good health and cellular function. Vitamin C, vitamin D, standard multivitamin, a low dose of vitamin B3, which I say 50 milligrams of niacin or niacinamide. And this is a newer one, but I'm really keen on it, especially if you have loose, long stools or issues like that related to the gut. Try 1 gram of Lysine before every meal. And then optional supplements that I've tried and that I think may be helpful, like a Super B complex or vitamin B12 at about 450 micrograms of B12 per day, quercetin to help stabilize mast cells, or an antihistamine. But just be careful, too much quercetin will stress your cells and trigger autophagy. And so like when I was taking quercetin, I would just take it Tuesday, Wednesday, Thursday, Friday, and like if I was doing autophagy fasting on Saturday and Sunday, I would not take quercetin on Monday because I didn't want to stress my cells. I wanted my cells to rest and recover on Monday. Now, things that alter the lipid metabolism of our cells and potentially decrease the lipid droplet formation, 10 milligrams of a statin or a low dose of the red yeast rice is roughly equivalent to 10 milligrams of a statin. Outside the US, some of the red yeast rice extracts actually tell you the dosage of monocolin K, which is nice. And I think, like 6 milligrams of monocolin K might be the appropriate dose for a long hauler. NAC, to boost our cellular defenses against oxidative stress, especially if you've got brain fog or shortness of breath. As you get better, I've kind of dropped NAC mostly, but I think initially it might be very helpful. And then finally, try aspirin or nattokinase. See if you notice any difference. These are all things to play with. Nobody has all the answers right now, including me. Anyway, that's my current thinking on the supplements, and thank you for your time. And I wish you the best of luck on your recovery from long COVID.